Hi, I'm David Hansworth. I'm a dentist here at Hansworth Dentistry. I'm here with my coordinator, Casey,
Hi.
and today we're going to talk a little bit about sleep apnea. So, Casey will get started.
All right. So I have a question for you. Can you tell me a little bit about obstructive sleep apnea?
Yeah, sleep apnea happens, people are sleeping, they try to breathe, but they actually stop breathing. The effort continues, and that can happen many times a night. To the point where the patient wakes up in the morning, if they sleep well at all, and they have excessive daytime sleepiness, which becomes a dangerous condition.
All right. What might be some patient concerns with that?
Yes, patients are treated by physicians often, and they wear a CPAP, which is just a mask that goes over your face. It forces air to open the airway, to keep it open. It can be a little bit noisy, so the patients usually complain about it. It's not comfortable to take on vacation. The compliance rate is kind of low. And the other thing patients are concerned with when they come in with sleep apnea, they also a lot of times have hypertension, so it's dangerous, diabetes. Some of the people have ADD. They don't realize it's associated with the sleep apnea. And they also can get fibromyalgia. So they're usually very uncomfortable. But they did a study in Turkey several years ago, and what they found is the patients had fibromyalgia and sleep apnea at the same time. They treated them with an oral appliance, and the jaw came down and forward, and guess what happened to the fibromyalgia?
What?
It got better.
Well, it's always a
And
good
what
thing.
happened to the sleep apnea? It improved. So the people were really happy, and that was without drugs, but it worked with just oral appliance. So that's an encouraging thing, and the dentists are able to help patients with these oral appliances for sleep apnea.
Can you explain a little bit about the medical model?
The medical model, yes. Patients are diagnosed, they're only allowed to be diagnosed for sleep apnea by a physician. So we work with a certified sleep center where physicians are on staff and they're all certified. They have a lot of credentials in sleep apnea. They can do a lot of testing for patients to show that these oral appliances do work. A lot of people who do well with their testing, their sleep testing, they don't have to wear a CPAP anymore, and they don't wake up with a mark on their face from the pressure of the CPAP, and so they feel a lot freer about that. So also what we can do with the physicians, they can follow up these patients to make sure that they're okay in the long run.
Okay. And what about oral appliance therapy?
Yes, a lot of times oral appliance therapy, here's one of the kinds we make. There's several kinds available that we make here in the office. And what this patient will wear this at night. If they do well with it, they don't have to always wear a CPAP, and the physicians will do a study on them to determine that. These are comfortable. They can be moved forward slowly over time to keep the airway open at night. And so the patients are happy about that. And then also what will happen is they're comfortable. And the CPAP, in contrast, usually is uncomfortable. So the compliance rates for these appliances is much higher than with the CPAP.
All right. And do you think you can explain a little bit further about TMJ and obstructive sleep apnea?
Yeah, the TMJ dysfunction, people have a lot of head and neck pain, jaw clicking, headaches, clenching, all these associated things, bruxing, they're moving their teeth around. A lot of those people, they can opt to get screened by a dentist who treats sleep apnea as well as TMJ, because I'd say over half of the people that have sleep apnea have some sort of TMJ dysfunction. So for them to be comfortable, for them to get all these conditions addressed, they can go to a dentist who actually treats both of them. So, and then they get a comfortable result. So, okay, I was just going to say thanks, Casey, for being here.
Thank you.
I'm Dr. Dave. We have a lot of good videos on our website, and we'll see you next time.
Bye.
Bye.